answering the 12 biggest questions about Apple and Google's new coronavirus tracking project. On Friday, Google and Apple joined together for an ambitious emergency project, laying out a new protocol for tracking the ongoing coronavirus outbreak. It's an urgent, complex project with huge implications for privacy and public health. Similar projects have been successful in Singapore and other countries, but it remains to be seen whether U.S. public health agencies would be able to manage such a project, even with the biggest tech companies in the world lending a hand. They reveal a lot about what Apple and Google are actually trying to do with this sensitive data and where the project falls short. When someone gets sick with a new disease like this year's coronavirus, public health workers try to contain the spread by tracking down and quarantining everyone that infected person has been in contact with. The system records points of contact without using location data. Essentially, Apple and Google have built an automated contact tracing system. It's important to note that what Apple and Google are working on together is a framework and not an app. They're handling the plumbing and guaranteeing the privacy and security of the system, but leaving the building of the actual apps that use it to others. In basic terms, this system lets your phone log other phones that have been nearby. As long as this system is running, your phone will periodically blast out a small, unique, and anonymous piece of code derived from that phone's unique ID. Other phones in range receive that code and remember it, building up a log of the codes they've received and when they receive them. Everything you need to know about the coronavirus. When a person using the system receives a positive diagnosis, they can choose to submit their ID code to a central database. When your phone checks back with that database, it runs a local scan to see whether any of the codes in its log match the IDs in the database. That's the simple version, but you can already see how useful this kind of system could be. In essence, it lets you record points of contact, that is, the exact thing contact tracers need, without collecting any precise location data and maintaining only minimal information in the central database. The system is working off the same antennas as your wireless earbuds, although it's the Bluetooth Low Energy (BLE) version of the spec, which means it won't drain your battery quite as noticeably. This particular system uses a version of the BLE beacon system that's been in use for years, modified to work as a two-way code swap between phones. Engineers on the project are optimistic that they can tweak the range at the software level through thresholding, essentially, discarding lower-strength signals, but since there's no actual software yet, most of the relevant decisions have yet to be made. In the first part of the project, aimed to be finished by mid-May, the system will be built into official public health apps, which will send out the BLE signals in the background. Those apps will be built by state-level health agencies, not tech companies, which means the agencies will be in charge of a lot of important decisions about how to notify users and what to recommend if a person has been exposed. Eventually, the team hopes to build that functionality directly into the iOS and Android operating systems, similar to a native dashboard or a toggle in the settings menu. But that will take months, and it will still prompt users to download an official public health app if they need to submit information or receive an alert. Based on the documents published Friday, it will be pretty hard to work back to any sensitive information based solely on the Bluetooth codes, which means you can run the app in the background without worrying that you're compiling anything that's potentially incriminating. Of course, the health apps that use that system will eventually need to know who you are if you are to upload your diagnosis to health officials. Could hackers use this system to make a big list of everybody who has had the disease? The central database stores all the codes sent out by infected people while they were contagious. That's what your phone is checking against, and it's entirely plausible that a bad actor could get those codes. The cryptography spec lays out 3 levels of keys for this system: a private master key that never leaves your device, a daily tracing key generated from the private key, and then the string of proximity IDs that are generated by the daily key. Each of these steps is performed through a cryptographically robust one-way function, so you can generate a proximity key from a daily key, but not the other way around. More importantly, you can see which proximity keys came from a specific daily key, but only if you start with the daily key in hand. A log on your phone is a list of proximity IDs, the lowest level of key, so they aren't much good on their own. Because those daily keys are now public, your device can do the math and tell you if any of the proximity IDs in your log came from that daily key. If they did, it generates an alert. As cryptographer Matt Tate points out, this leads to a meaningful privacy reduction for people who test positive on this system. Once those daily keys are public, you can find out which proximity IDs are associated with a given ID. It's possible to imagine a malicious app or Bluetooth sniffing network that collects proximity IDs in advance, connecting them with specific identities and later correlating them to daily keys scraped from the central list. To sum it up, it's hard to absolutely guarantee someone's anonymity if they share that they've tested positive through this system.